Hey there, thanks for stopping by the Rosewood Holistic Health website. My name is Monica Leibacher, and I'm a licensed massage therapist here in Celebration. And the office, Rosewood Holistic Health, is located indeed here in Celebration, Florida. Massage is the topic of this video. I want to tell you a little bit about exactly what massage is, and then go into a little bit of detail about deep tissue massage. Massage is a manipulation of the soft tissue in the body, and soft tissue in the body could include any of the following. Could include the skin, could include the fascia, could include the organs, could include muscle, of course, tendons and ligaments. And the whole goal of massage is to restore function, range of motion, to eliminate or lessen stress and pain in the body. Swedish massage is the foundation for other types of Western massage as well. Is sports and, as I just mentioned, deep tissue, which, like I said, I will talk about a little bit more in a moment. Massage can be applied with hands, fingers, elbows, forearm, and even the feet. That's called ashiatsu. Oil and lotion are used to allow the therapist's hand to glide over the skin, although sometimes it is not used, and that depends on the modality that's being employed by the therapist at that time. Massage is done with the person covered by a sheet. This is called draping, and that is the way that I perform massages. That's required here in the state of Florida. One part of the body is uncovered, massaged, and then covered back up before moving on to another area. A person can lay on their back, their front, or their side to receive the massage. Sometimes the position of laying is indicated by what the goal for the massage is, what the therapist is trying to achieve, and sometimes the position that the individual lays is determined by the client's comfort. If there is a position that is more or less comfortable to you, please let the therapist know, and we can either have you in or not in that position. Some people, for example, ladies who are pregnant, really like the side lying position, and they are encouraged to bring their body pillow with them, or whatever it is that helps them be most comfortable in the laying down position. Now, some forms of body work, I mentioned the draping. Well, some forms of body work are done completely clothed. Craniosacral therapy, manual lymphatic drainage at times, and at times visceral manipulation. The individual does not need to take their clothes off and get under the drape for the massage. And if an individual would prefer to just remain clothed during their session, that is a-okay. Whatever is most comfortable. Usually the comment that I make as I head out of the treatment room is to undress to your comfort level. And if that means leaving on your socks and shoes, then so be it. The times when an individual would not be a good candidate for massage, things like diarrhea, vomiting, acute phlebitis, deep vein thrombosis, those things that you probably wouldn't feel like getting a massage anyway, are what we call contraindicated. It just means that massage is not a good idea at that time. Doesn't mean that once those things go away that the individual wouldn't be a good candidate, but we just like to have everybody in the best of spirits and health as they go into a treatment session. Notify the massage therapist of any health condition that you have. That way adjustments can be made, and that massage is administered in the most beneficial and the safest way possible for you. Now, on to the deep tissue topic. If you've looked through some of the other pages on my website, you will know what I'm going to say and my philosophy and thoughts about deep tissue. Here it is, plain and simple. Deep tissue is one type of tool that a massage therapist can use, and it is not always indicated. The amount of restriction that you have does not indicate the amount of pressure that a massage therapist applies. Large restriction, large pressure. Small restriction, small pressure. Doesn't work that way. Massage therapists are trained in what's called palpation, and a therapist who is skilled at using that palpation is going to monitor the response of the tissue as they're pressing on it to determine how much they need to press and the way they need to do that. Let me give you an example. A person may suffer from a frozen shoulder, and it may have been that way for a long time, and it could be really stuck and really sore. But their body may only need a little bit of outside facilitation in order to get over that hump, to be freer in motion and to be less painful. And it's for this reason that the therapist needs to pay attention to that palpation. Other things might come into play, like somato-emotional components. Say, for example, somebody was in a rear-end car accident. They were hit from behind. As they were getting to work, they were running late. And so there was a lot of, maybe stress, a little extra angst in the whole situation. And then all of a sudden, the whiplash occurs. That extra stress, extra angst can sometimes be tied into that restriction, and I cannot speed up the release of that area by pressing on it more. The body it doesn't work that way. Pain tolerance in general is also a good indicator. If somebody is not very tolerant of pain, then obviously they're not going to want somebody pressing really hard. But it also can be said that the more specific and more accurate a therapist is with finding the restricted muscle tissue, there may be some pain that's involved in the release of that, but that pain is not, is not created by the therapist. The pain is actually residing there in the tissue, and it only becomes evident when the therapist finds it and touches that spot. So I like to really make sure that that's super clear for people. The client's ability to adapt and overcome how in good health they are. Like if somebody has a lot of health conditions, for example, it would just be unnecessary, and it would just almost be contraindicated to do any kind of pressing really hard. Also, the area of the body that is affected does not indicate that since it's that area, it must require deep tissue. Like the leg, for example. The leg, it's a big area on my body. That means it must require deep tissue. Or, it's my face. So that, of course, no deep tissue there. But that's not necessarily the case. Sometimes a quadricep muscle, just by a specific craniosacral therapy holding, or a little bit of friction in an area, is all that the body needs. A little bit of stimulus there to actually cause a shift or a change in the muscle fiber. And that's all we're going for, because if we can achieve the goal in the easiest way possible, why wouldn't we, right? So It is for this reason that you don't see an extra treatment option for deep tissue treatment. It's like if I hire a contractor to come to my house and he says to me, "Would you like me to use a hammer?" Well, if you need to use a hammer, please use a hammer. But if you don't need to use a hammer, then don't use a hammer. And I can't, as the customer, tell him when he should be using the hammer. I'm just going to rely on him. If he sees nails that need to be pounded, that the hammer will be used. And if he's working on plumbing, he's probably not going to use the hammer, and it's probably going to be his wrench. And so I don't charge more for deep tissue. It is simply one tool in my tool belt, along with all of the other modalities that I employ and the certifications that I have, certified in craniosacral therapy, manual lymphatic drainage, have additional training in visceral manipulation, myofascial release, and all of those things are things that I rely on to get you to your goal. Let's see here. What else can I tell you? During the treatment, I'll monitor the tissue. I will. I'm not going to be planning my meal for the night or making my grocery list out. I am thinking about what I'm doing while I'm working with you. And I'm going to be using the most accurate precision in my techniques as possible for you. Though deep work does have its place, and I may offer a little more pressure at times, when it is not indicated, I don't use it. Those are my thoughts on deep tissue, and I hope that this helps you. I really look forward to working together with you to get you out of pain and back into motion. Have a great day.